let's see. Hold on. Say hi, Faith. Hi, we're recording now, Wes. Hold on. There we are. Say hello, Mr. Hall. Wes. Hello.
Hello.
Okay. That's an interesting way of bringing it up. I have the video camera hooked onto
your cup holder.
My coffee cup holder because my daughter's not here to videotape for us today. So I have a clothespin and a coffee cup holder. So points for creativity would be appreciated. All right. So Amy Hall, Nursing 210, final video assessment. All right. First thing that we're going to do is we're going to assess upper extremity skin. So I'm looking at the color, which is tan with some freckles. Temperature, which is warm. Texture, smooth. Turgor, good skin turgor. And no lesions or varicosities are noted. And, oh, it's okay. It's all right. And then we're going to look at your lower extremities. Color, tan, temperature, normal. Texture, smooth, good skin turgor. Everything's normal there. All right. Now let me see your hands. I want to look at your nails. Okay. Other than these two that were obviously mutilated in your lawnmower accident, your nails are pink, adhered to the nail bed. When I put your hands together, nails together like this, nails together, very good. Okay, got a normal angle there.
The camera can't see that.
Well, I'm doing the best that I can. Okay.
Move over this way.
All right. Well, I don't know if she can see it off over that way. So the next thing that we're going to do is we're going to go ahead and I'm going to check your hair. You have coarse hair. It's grayish brown. I'm going to palpate and check your skull. You got no infestations. Although you do have what looks like a piece of chocolate in your hair, which I will remove for you for free. All right. Next thing I'm going to do is I'm going to inspect your eyebrows. And your eyebrows, you've got normal hair distribution there. Your eyelashes, top and bottom are normal. I'm palpating your lacrimal sacs and they are normal. All right. Next thing I'm going to do is I'm going to touch your face. Tell me any pain here?
No.
Okay. Checking for your sinuses here. Ethmoid, sphenoid, paranasal. No pain there?
No.
All right. So the next thing that we're going to do is we're going to inspect your mouth. Open your mouth up for me. Open up wide. All right. I know that you no longer have your uvula. That was removed when you had your palate surgery, correct?
Yes.
Lift up your tongue. Let me look underneath. All right. Frenulum's intact. Organs ducts, so everything's fine there. Your teeth are normal. See, you have your little prosthetic up there. Beautiful. Get rid of that. The next thing that we're going to do is ask you to try to hold your baby. Hi, Mama. I'm going to look in your ears.
Baby!
All right. Come towards me so I can see your ear. Good. All right. Outer structure of the ear, symmetry of the ear. It's perfect. I'm looking inside. All right. I see. Oh, no, Faith, Lou. Don't pull that. That hurts Papa. You don't want to move this when it's inside someone's ear. Okay. Tympanic membrane's intact. Let me see the other side if you can. Okay. All right, and I see that little hourglass. Tympanic membranes are grayish and they're intact. Everything's fine there. So when we're looking at the head, we're looking at the symmetry of the head. We're symmetrical on both sides. We saw the symmetry of the ears. There's no injuries there. Next thing we're going to do is look at your nose from the outside. I can tell that you've had your nose broken before. It kind of goes off to the side. I'm going to real quick look up your nose. All right. Turbinates are pink and normal. I don't see any excessive rhinorrhea up there, which means you don't have a boogie nose. All right. Everything looks good there. And we just feel the palate on the top of your mouth. Palate's intact. Okay, the next thing that we're going to do is we're going to go ahead and we are going to check out your eyes. That's right, Mama. We're going to check Papa's eyes. The eyes. Okay. When you're looking at the eyes, you're looking at me. All right, just look at my nose. Look at the little spot on the end of my nose. All right, so I see a red reflex. which is normal. It means the light's reflecting in the back. And everything looks beautiful inside there. Your sclera are nice and white, and everything is intact. Everything is clear. Corneas look fine. Next thing we're going to do is go ahead and check your neck. Spine is processed. Any pain when I palpate?
No.
All right. Next thing I'm going to have you do is we're going to check how your head moves. Lean forward against my hand, backward against my hand, to the side against my hand, to the other side against my hand. Very good. You like that? You want something to play with? Mama give you this to play with. Here you go, Bumpy. Bumpy, Bumpy. Okay.
Thank you,
fun?
Mama.
All right.
Thank you.
So we did your head. We're moving down into your neck. So I'm going to palpate for your lymph nodes, submental. Don't remember the rest of the names, but that's okay. I'm feeling for them, and I don't feel any enlarged lymph nodes, which would be a sign of infection or possible disease. Next thing I'm going to do is feel for your trachea. Your trachea is midline. There's no obvious shift. All right. Now I'm going to try to feel for your thyroid. I want you to take a swallow. Okay. Don't feel any nodules on your thyroid. Next thing that I'm going to do is I'm going to try to remember what comes next. So we'll go system-wide. The next thing that we're going to do is I'm going to listen to do your chest. So I'm going to inspect your chest, anterior and posterior. All right. And I'm inspecting. I don't see anything abnormal here. Any pain when I palpate?
No.
Okay, we have normal color, normal male pattern hair distribution here, and I notice down your abdomen you've got a little scar from when you had your hernia surgery, correct?
Yes.
Okay. Next thing that we're going to do, babe, can Mama have her ears back? Thank you, sweetheart. You go, little girl. Okay. We are going to listen. Well, you know what, before we do that, stand up. Hold her. Okay. I'm going to ask you to take a deep breath in. Okay, and breathe out. Checking for thoracic expansion. Okay. The next thing I'm going to ask you to do is lean forward just a little bit. A little more. A little more. Okay, take a big deep breath in. Okay, now breathe out. Okay, that would be measuring your diaphragmatic excursion, which is how much your diaphragm moves up when you take a deep breath. We'll take a listen to your lungs on the back. Deep breath, in and out. Again. Again. And again. Okay, turn around. Is that funny? It's funny. Okay. Hi. So we're inspecting the chest for heaves and thrusts. I don't see any. Palpating for the point of maximal impulse. Okay. And now I'm listening. Aortic. Pulmonic. Erb's point. Tricuspid. You have normal lub-dub, lub-dub, lub-dub. I don't hear any murmurs or anything like that. Okay, the next thing I'd like you to do is pick up Faithy Lou. Say hi, Mama!
Baby!
Okay. And I just remembered that I forgot to check your cranial nerves when we were doing your head. So we're going to go back and do your cranial nerve assessment here. First thing I'm going to have you do is go back to the eyes and have you follow my finger. For the 6 cardinal positions, we're going this way. Just follow. Don't move your head. Just your eyes. All right, very good. Now stick out your tongue. Stick it up, down, left, right. Okay, very good. Now, I want you to go ahead and smile, frown, show your teeth, puff out your cheeks, purse your lips like you're blowing a kiss. Okay, close your eyes. Try to open them against my fingers. Very, very good. All right. Something that I'm going to have you do now, I want you to close your eyes and identify a smell for me, okay?
stinks though. Mouth welling.
Yes, very, very good.
Ugh.
Mama's busy, honey. Okay, keep your eyes shut. Here's another smell.
What are you doing?
Flowers or something.
Mommy, what
Some
are
kind of
you
flowers.
doing?
I'm doing my homework, sweetheart.
Nathan, we'll be out in a minute.
5 minutes, buddy. You can play your game for 5 more minutes while Mama and Papa are doing her homework.
But we can't give the Lego thing power.
Okay, well, you have to wait till we're done doing my homework, dear.
Okay.
Okay?
Thank you.
Next thing I'm going to have you do is lay down. We're going to do your belly assessment. I need to see your belly. Okay? You always listen before you touch. Looking at the abdomen, like I already said, we have belly button goes in, not out. We've got normal male pattern hair, and we have a little scar from an old hernia repair. Can you try to hold her? I'm going to listen to bowel sounds. Normal bowel sounds are between 5 and 30 a minute. Baby.
She wants to try it too.
Okay, hold on, butter. I know, you're such a good girl. Come here, baby. All right, so after listening, we'll percuss the abdomen, or at least we will attempt to. Are you able to? She's going to scream.
Baby. I'll help you up. Come on. Stand up. Stand up.
Okay.
That's a
And we're
girl.
going to palpate.
Big girl.
Any pain?
No. No pain.
And we're going from gallbladder, liver, aorta, stomach, and spleen. And now I'm just going to try to listen to see if I can oscillate any abnormal sound over any of your organs or your iliac or your femoral renal arteries. It's hard to hear with you crying,
You're
baby.
doing it. You're doing it. You're doing it. You're strengthening up. Good job. Good job.
And abnormal sounds over the liver could be a sign of portal hypertension or other problems. Okay, next thing that I'm going to do, I didn't do your lower extremities, so we'll be checking color, temperature, and texture. Color, pinkish brown, tan, temperature warm, texture normal, skin texture. Turgor is good, no varicosities noted, no edema noted. And on your fingers and on your toes, we have less than 3 seconds, so we have a brisk capillary refill. Very good. You can go ahead and sit up. The next thing that we're going to do, don't cry, honey, it's okay. It's almost over. Next thing that we're going to do, I'm losing my mind here. We checked your head, we checked your neck, we checked your arms. No, we're not doing your hands yet. You want to play with my stethoscope? You can play with my stethoscope. Can you play with my stethoscope in here for a minute? Yay! That's fun.
Baby.
Okay, we're going to do your central nervous system. Hi, baby. Okay, I'm going to check all of your joints right now. We're going to do musculoskeletal. All right? So, I'm going to palpate your cervical spinous process, your shoulders, your elbows, your wrists, your fingers, your hips, your knees, your ankles, and your toes. And there's no pain on any joints on palpation? All right, I'm going to check range of motion of your neck. So, can you lean your head back all the way? Down all the way. Good. Neutral position. To the right, to the left. All right, now push against me again. Backwards, to the side, to the side. All right, very, very good. Got something on your face there too. Okay. Next thing I'm going to check is your shoulders shrug against pressure. All right, now show me how you shrug your shoulders normally. All right, now put your hands behind your back here. All right, external rotation, and then like the kids at karate in the resting position, internal rotation. Very good. Any pain when you do that? All right, the next thing I need to see is your arms. Put your arms up like you're lifting weights. Now I'm going to try to pull, and don't let me pull your arms down. All right, checking your biceps and then push. Checking your triceps. Now do like your thing, hooray. Push up, against me. Okay, very, very good. So you've got good muscular strength everywhere there. All right, stand up. All right, now with the hips, lean forward from here. Lean backwards as far as you can. Extension, good. To your right, to your left. All right, then turn around in front of me. Lean all the way down, touch your toes, and then stand up. All right, that's a test for scoliosis. And your spine is nice and straight. All right, sit down. All right, now lay back. Lay back. Hi, baby. All right, I'm going to lift this leg up. Just let me. All right, so we're going to go ahead with internal rotation, external rotation. No problems with that, correct? Okay. Now I'm going to have you sit up. All right. So now what I want you to do is I want you to go right to left with your hands. Radial and ulnar deviation just with your wrists. Okay, very good. Now I'm going to have you touch. 1, 2, 3, 4, 5. All right. Very good. Now, the next thing that I'm going to do is have you, with your feet, lift your toe up towards the ceiling. All right. No. Leave your feet flat on the ground. Just lift your toes. Good. That's dorsiflexion. Now point down. That's plantar flexion. Now put your foot sideways. Very, very, very good. Okay, no problems there. Now, with me pushing down, try to lift your feet up. Okay, now with me underneath, try to push down. All right, very good. Now put your hands together like this. Push them apart. Push them together. All right. Now, I'm going to squeeze. Push them apart. Okay, very, very good. Now I'm going to put my fingers in between, and you're going to push them together. Yeah, push them together. Oh, don't hurt me. Calm down, baby. It's okay. Say hi, Mama's professor.
Hi,
Adorable.
baby.
You have a cute little girl, and I don't want Mama to get up to grade on her test.
You want to get down?
The next thing I need you to do is I need you to walk that way.
Okay.
Heel toe. We'll walk normally over there. Okay, so you have a steady gait, and then turn around. Hi, babe. Heel toe. Heel toe. Heel toe. Very good. Excellent. Now, stand up. You, stand up. Okay? And close your eyes. And this is called the Romberg test. And the Romberg test is just checking that you don't fall over.
I have her.
Yeah, I know. Well, I have to make sure the baby didn't fall over either. All right, so you can pick her back up. Some of the other tests that we would do normally would be the Snellen test, which is where we have the letters on the wall 20 feet away from you to check your vision, and we would check you off at whatever level was the last one you got them all right. And then there's the, I think it's Rosenberg test, which is the near one, which checks how your eyes focus when you're reading close up. Next thing I need you to do, stand back up. You're not off duty. Do the quick pronation, supination, faster. All right, very good. Now we're going to pretend you're in the back of a police car. You just got pulled over, and we're going to do the nose, finger, close your eyes. Go ahead. 1. You have to come over here so you're on the film, huh? Okay. Go ahead, do it. All right, very good. The next thing that we're going to do is we're going to go ahead and do, close your eyes. I'm going to put an object in your hand, and you have to identify what it is with your eyes shut. What is that?
Coin.
Very good. Sternographia. Other hand.
Nail polish.
Very good. Next thing I'm going to do is with your eyes shut, I'm going to write a number.
3.
Okay? With your eyes shut, I'm going to write a number.
9. 8.
Very good. All right. So we got those done. We checked your nose. We checked the other stuff. Why don't you hold her for a second?
Baby. Mwah.
All right.
My baby.
The next thing that I need to do,
My baby.
talk about the wind test and the Rhine test. I'm going to put this on your head, and you tell me which ear you hear it better out of.
What am I supposed to say?
Do you hear it better out of one ear than the other?
I don't hear it at all.
Okay. Now,